Welcome everybody to Wise Women Wednesday. I am here proud to join Dr. Tia Cherie Gaynor and Jackie Marshall as we chat about race, racism, and allyship. I know we've got a few people joining, so we'll let people roll in, and we are live on Facebook today. I could not be more proud to be able to provide this platform for dialogue and conversation. I am hopeful that everybody shows up today ready to learn, listen, and engage. Most importantly, taking away something that they can do to really drive change in your community. So thank you so much for joining us today. As you know, it is Heart Month here in our communities, but it is also Black History Month. And so we've got a lot of things intersecting here that I think that having the voices that we have and the experts in the room being able to talk about what is going on with the health and wellness of our communities, and what are the driving forces behind a lot of the things that we're seeing. So I'm going to leave it to the experts, Dr. Gaynor and Jackie, to have this incredible conversation today. And all that I ask is that we have respectful dialogue today. If you have questions, please paste them in the chat. If you have something burning, please feel free to go ahead and come off of mute and engage. What we're really looking forward to is just having really meaningful conversation here as a community that can help to drive the change we want to see in our communities. So thank you so much.
Yeah, thank you for having us.
Yeah, thank you.
Yeah, so I am a master's student at UC, and I have the extreme privilege of being taught by the Dr. Gaynor. So thank you so much for joining me with this in this conversation.
Oh, of course. Thanks for the invitation.
Yeah, so diving right in, Dr. Gaynor, you did some research on the disparities of COVID-19 at the beginning of this pandemic. And you wrote a article about some of the research that you did. And one of the things in that article that you wrote is that the virus does not see race, gender, or class, yet it interacts with each of these modifiers in ways that exacerbate the existing oppressive systems that operate to maintain this social hierarchy. And so explain that to us, like explain what you found in some of your research that you did.
Yeah, so before I jump into that, just for those who are here who don't know me, which I'm sure is many people, because I'm not as famous as I want to think I am. So Tia Gaynor, I am on faculty in the Department of Political Science at UC. My academic training is in public administration. So that really focuses on the ways in which government and nonprofit organizations operate. So if you think about business administration and the way that corporations and small businesses operate, public administration is very similar, but thinking about public and nonprofit organizations. And so all of my research centers around some kind of social justice issues. And I'm particularly interested in exploring and highlighting and illuminating the ways in which identity play into how public officials make decisions, what decisions they make and what decisions they don't make, how it shapes policy. And so I'm very interested in the intersection between identities, public policy management, and then injustice, marginalization, and oppression, right? And so very early in the pandemic, once race-based data or demographic data started to be collected, it became really clear that there were some racial disparities. It became clear that people of color were faring far worse in the pandemic, right? Their infection and death rates were significantly higher than their national population or the population in the states, right? And that was pretty consistent over the country, across the country. And so a colleague of mine, Dr. Megan Wilson at Michigan State University, we wanted to start to better understand, or I don't even know if better understand is the right word, because we had a pretty good sense of what was happening, but we wanted to really call it out and put it out there. And so what we did was we took a look at the infection and death rates of Black people. We focused on Cuyahoga County in Ohio and Wayne County in Michigan. Number one, for convenience purposes, right? I'm in Ohio, she's in Michigan. Those counties have the highest population of Black people in the states. And what we really wanted to do was see if there was a relationship between where Black people lived and infection and death rates related to COVID. And so the CDC has what they call the Social Vulnerability Index. And the Social Vulnerability Index measures about 15 different variables that range to access to transportation, concentration of a community, proximity to environmental hazards, right? So it measures all of these different things. And what the Social Vulnerability Index tells is how resilient a community is in responding to or recovering from a natural disaster, an emergency or crisis situation, or a man-made disaster. And so what our research does was it looks at communities that have high levels of social vulnerability and tries to map that to COVID infection and death rates. And what we found, and honestly, our findings weren't really surprising, but what we found was that Black communities with higher rates of Black people living within them, are also communities that have higher levels of social vulnerability, right? So they have less resources and less infrastructure in place that allows those communities to respond to these crises. And there was a relationship between those communities and COVID infection and death rates, right? And so what that tells us is that Black people are more likely to become infected and die of COVID-19, right? And part of that is linked to the communities in which they in which they live, right? And so we also know that issues of racism are deeply seated in the way in which this country was developed, deeply seated in the ways in which our policies were developed and how decisions are made, right? So it's really no accident that these communities with higher populations of Black community are also communities that are more proximate to environmental hazards, right? These are also communities that have been impacted by transportation and the building of highways, right? And highways went straight through their communities, right? And so it's really not a surprise, but we know that these issues are so interconnected, right? And so when we think about those communities, these are communities where the school system isn't the same as their suburban counterparts, right? Or cities with higher concentrations of white residents or non-Black residents, right? And so education plays into what kind of employment you can get. What kind of employment you can get plays into your income. Your income plays into how you access healthcare, right? And so all of these things are intertwined. And so, our findings weren't really surprising to us, but they really helped illuminate the web of policies and how policies operate to intersect with one another to create what we now see, what we saw last year at the start of the pandemic and continuing the pandemic. And now we're starting to see it with the rollout of vaccines, right? So we're seeing that there's racial disparity in who has access to or who's been getting the vaccine. And I just, in preparation for our conversation today, I looked and the CDC recently released some statistics for February, and like 63% of folks who have gotten at least the first phase of the vaccination were white and 6% were Black, right? In comparison to the fact that we know that the Black community, communities of color, the Native community is most impacted by COVID, right? And they are so significantly the numbers in terms of being able to access the vaccine are so significantly lower, right? And so when we think about population numbers, access to the vaccine is not on par with population numbers. Access to vaccine is not on par with infection rates, right? So we see these disparities, and we see these disparities along racial lines. And so that's kind of a high level of what our research shows. But I mean, it really does push the notion that these issues don't operate in silos, right? And so, we're having a conversation about, that really centers racial disparity, racial equity in health. But it's important to recognize that health connects to so many different things. It connects to access to transportation, it connects to jobs, it connects to public schools or education, it connects to criminal justice. All of these things operate together to produce what we're seeing.
Yeah, that's super interesting too, because I'm wondering if that social vulnerability index was used like as a way to gauge how to distribute the vaccine. So it's interesting that it's there and it says all of this information, but are we using it to make policy and stuff like that?
Yeah, so that's a really good question. I don't have the answer to that. My assumption is that we're not looking at that. And I mean, the disparate rates, right, of access to the vaccine are showing that there isn't an intentional plan to implement the delivery of a vaccine in a way that mirrors how our communities have been impacted by COVID, right? And so it seems like they haven't looked at the vulnerability index. It also seems like they're not really taking a racial equity lens to the ways in which we are approaching, or they're approaching, the rollout of the vaccine and the distribution of the vaccine, right? And so no one is disputing that frontline workers, healthcare workers shouldn't be one of the first groups of people, right? But when we think about the folks who were out there in the end of March over the summer, it wasn't just healthcare workers, right? There were people who were driving buses, there were people who were working in the grocery stores, there were postal service workers, right? And these are positions that have large percentages of people of color who were working in them. And these are also the jobs that we determined, or that government determined was mandatory during quarantine, right? But these are also positions that don't have early access to the vaccine, right? And so there's a misalignment there. Like, if these positions and these people are so vital to our economy, then we should be prioritizing them to get access to the vaccine. And we should be doing it in a way where more people can get information, right? So when we think about the vaccine, most of the information that we have in terms of signing up or putting ourselves on a list, it's all web-based, it's all internet-based. So if you don't have a computer, if you don't have access to the internet, what are you gonna do, right? I mean, I know for me, I have tried to call. I've called several times and have never gotten anyone to pick up the phone, right? And that is not to put anyone down, but it is to say that there are barriers that are being put in place that prevent access to the vaccine, right? And it's very disappointing, at least for me, who studies the role of identity in these issues, because we knew very early on in the pandemic that there was racial disparity, right? So we could have been very intentional about looking at those numbers and connecting with community organizations and other spaces within those communities to figure out how best to deliver the vaccine to the communities that have been hit the hardest.
Right. And, I also wonder too, like, many of those organizations, say like the Krogers and the Walmarts and stuff like that, like, I can only think that they're probably buying up vaccines to distribute within their pharmacies. I don't know how true that is, but if that is the case, I mean, what about their employees and stuff like that? You know what I mean? Like, I think about all that, like, they probably spend a lot of money doing certain things to benefit their customers, but what about their people?
Yeah, absolutely. I mean, I know that pharmacies like CVS, Walgreens, Kroger, um, or maybe not the Kroger specific pharmacy, but the little clinics that are located in Kroger's, they are all listed, you know, when you go on the state website to see where, you know, where vaccine distribution centers are, they're all listed there, right? But to your point, Jackie, there's a disconnect that's happening, right? I mean, there was a report that just came out, I think it was yesterday, about California, and it talked about the concentration of wealthy white people in California that have gotten the vaccine as opposed to other communities, right? And we know California, and I mean, they have been really dealing with high infection rates for a really long time, right? And so how is it that a state like California isn't going to be intentional about the ways in which it distributes its vaccine? And it's really disappointing. And I mean, to be frank, to me, it shows that we just don't care, right? It's not, you can't say you don't know because the data's there, right? So you have this data, what are you doing with it, right? And so to me, as someone who has spent their academic career looking into these things, you can't say that you didn't know. So then if you do know and you still choose to do things the way that things have always been done, then to me that says that you don't see this social group of people as worthy of getting access to this in a way that other people have, right? I mean, we even saw the disparity in being able to access testing early on in the process, right? And how celebrities and people with financial resources were being tested. You know, we saw the incident recently where the two women dressed up as grannies to try to get vaccines, right? And I mean, so we are seeing like this pandemic is highlighting disparities that already exist.
Right.
Right. And then we are seeing the impact of that in the way the pandemic is playing out in a myriad of different ways.
Mm-hmm. And so I'm going to transition a little bit. So like when we talk about how like racism is leaked from, or not racism, but like these disparities are almost leaked from how like segregation of housing and stuff, that kind of is like, I don't want to say the root, but it is a root of accessibility and stuff like that, like schooling and education, just like you were saying, and access to healthcare and education and all that stuff. Like, who, I mean, the government caused that problem, but who do you kind of think takes on that responsibility to address these issues? Is it the healthcare entities themselves, or is it the government, or like, is that confusion altogether why nothing has moved the needle? You know what I mean?
Yeah, so I don't think it's confusion. I think all of those systems are responsible because all of those systems were responsible for creating the issues that we see today, right? And so all of those spaces are responsible for identifying solutions. So what we do here in this country is we silo issues, right? And so if it's an issue of education, then the education space deals with it. If it's an issue of health, then healthcare or nonprofits that focus on healthcare, they deal with that, right? Like very rarely do we have like co-productive, collaborative, collective responses, right? Very rarely do we look at an issue holistically and say, okay, well, what are these root causes, right? And how do we address all of those root causes to address this big issue, right? And so without addressing those root causes, these issues just continue to perpetuate over time. And that's what we see, right? And so when we think about health disparities, yeah, like addressing the immediate health issues that people are dealing with are critically important. But if we don't address the fact that lower income communities of color are more likely to reside against environmental hazards, then we're not going to solve the issue, right? We're just going to put a Band-Aid over the issue and address, health issues, if someone has, I don't know, whatever it is, like asthma, right? Like in order to deal with asthma or reduce rates of asthma, you have to deal with what people are exposed to as they grow up, right? You know, I think about the village of Lincoln Heights and the Lincoln Heights community, and the fact that the Cincinnati police gun range is located immediately next to a neighborhood, right? That gun range is used 300 something days a year. It's used 6 days a week, and it's used for like 7 hours a day, right? I can't imagine what the trauma and the toll of hearing gunshots every day, all year does to generations of a community. I also can't imagine what that does to the environment, right? It can't be good for the environment. It can't be good for the soil, right? And so, you know, when we think about health issues, we have to think about things like that too. And so, you know, I don't think that as a country, we look at issues holistically. I don't think we look at the root cause of issues. I think there are a number of reasons for that, which we can go into if you want to. You know, part of that is the way that our political system is set up. And so every so many years, we have a change in people in offices, right? But without that, we're not dealing with the systemic issues. We're not dealing with the roots, right? So you can't plant a garden in tainted soil, right? And so you have to deal with that soil in order to have fruit and vegetables and everything else, right? And so, you know, I really hope that we start to think about ways in which we can be collaborative in how we approach these issues. And we can work with communities in a very holistic way. We can connect with community organizations that are on the ground working. We can hear the lived experiences of people in those communities and value those lived experiences. And, you know, really think about how to address these issues, how to address all aspects of those issues, because that's the only way we're going to affect fundamental change.
Right. From the chat from Emily, she said, can you repeat the statistics on access to COVID vaccination of the Black community compared to the white community?
I didn't, let me see.
There is an Inquirer article, right?
So the Inquirer had an article, and I looked at, so I pulled some information from the CDC. So they said as of February 16th of this year, they have racial and ethnic data for 55% of the people who received at least one dose of the vaccine. Of those people, 63% are white, 9% were Hispanic, 6% Black, 5% Asian, 2% American Indian or Alaska Native, and less than 1% Native Hawaiian or other Pacific Islander.
Yeah, that's wild.
Right. And I mean, you know, we can talk about, you know, death rates thus far, right? But there's serious disparities in the rates of death as well by race.
Do you think that is because of access to healthcare? Is that one of the reasons you think?
For what? The vaccine stuff?
The death rate. Sorry, my bad.
I mean, I think that's part of it. I think access to healthcare is part of it. I also think that people of color are more likely to work in the positions that required, you know, that didn't allow them to work remotely, right? So that's a huge deal, right? I mean, people who are working in supermarkets, postal workers, people who are in public transportations. I think that's a more significant role. I think that issue plays a more significant role, but I think access to healthcare is part of it, right? I mean, there's no one reason, but I do think that, you know, lower income people of color were less likely to work remotely, right? And we saw disparities in that too, because who can like, who are the people, generally speaking, that can stay home and work, right? And so, you know, for those people who couldn't stay home and work, then they also had to figure out, if they had children, what was going to happen with their children, because their children weren't in school, that were in school remotely or virtually, right? And so all of these things just kind of compound on and create what we're seeing.
Mhm. Can you talk about how like specific policies and like practices reinforce the racial disparities like within healthcare systems and all systems, quite frankly?
Yeah, so I mean, there are books on this. So like, this is a really, really deep topic, but I mean, when we think about the evolution of policy in this country, policies either have been very intentional about creating some kind of disparity or providing access to some people and limiting access for other people. But also, none of our policies were created in thinking about, like, none of our policies were created through a racial equity lens, right? Even policies that we have today aren't created through a racial equity lens. I mean, you know, there are a number of states now that are legalizing marijuana, but many of those states aren't engaged in restorative justice practices, right? And so the people who are benefiting from the legalization of marijuana are not the people that were criminalized for possessing or selling it, right? And so these are the things, this is the way that policies operate and have operated since the beginning of time. And so, I mean, it's hard to identify one because there's just so many. It's so ingrained in how our country was developed, how race has been encoded into law, whether explicitly or implicitly, right? But we also see it in big P policy. So, like laws that are passed at the federal level or the state and local level, but we also see it happening in little p policies. So the policies that govern organizations, right? Or policies for how people work in organizations, or the procedures that govern people's work, right? Racial equity is not included in the development or in the assessment of those policies, right? And so when we're developing policy, we're not thinking about the racial impact, and not just race, right? But we're talking about race in this conversation. But then when we're looking at how effective a policy is, we're not including race or other identities and looking at what those disparities are either. And so if we don't look for it, we're not going to find it. But that also doesn't mean that it's not there, right? And so one of the things that we teach our NPA students is how to think about policy through a racial equity lens, and also how to assess policies through a racial equity lens, so that you can see whether it's a piece of law or whether it's an organizational policy, whether or not it is resulting in racial disparity and what that looks like, right? And so we can put policies in place that reduce racial disparity. We just have to be willing to do it, right? And so, you know, oftentimes we don't want to do the hard work. We want to do things the way that it's always been. We want to maintain the status quo. There are benefits for some people in maintaining the status quo. And so why change it, you know, if it's not going to benefit me? And I feel like that's kind of where we are.
Yeah, and that kind of brings me to my next point too, is that like, I feel like last summer, you know, it sparked everyone, not everyone, but many people to begin their unlearning and anti-racist research, and to learn all of these things, have their discussions within their groups and their friends and stuff like that. And we're kind of stuck there. And so how do we take all of this stuff that we are learning and now going beyond just allyship and listening and putting that stuff into practice?
Yeah, so I have some feelings about last summer and the Black squares and all of the Black Lives Matter statements. I feel like the majority of it was performative, right? It was all symbolic. You know, Walmart, I think, put together $100 million racial justice fund of some sort, right? But didn't change the minimum wage for employees, right? If you cared about Black lives, if you cared about the Black people that worked for you, you would pay them more money. It's certainly not like companies like Walmart can't afford to do that, right? And so, yeah, it's great that you created $100 million racial justice fund and you're gonna give this money out to different organizations. That's fantastic. But what about the people who are working for you, right? And so when I think about your question, those are things that I think about. You know, what can we do? I mean, things can be done to fundamentally change people's lives, right? And so I think about, you know, I say all the time, and maybe I shouldn't even say this in this space, but, you know, I say all the time, like, last summer, it was like, for many white people, all of a sudden, they believed racism existed, right? Last summer was not, like, George Floyd was not the only Black man to have been killed by police. He wasn't the only Black person killed by police last year, right? There was an outrage around Ahmaud Arbery. There wasn't a ton of outrage about Breonna Taylor until George Floyd was killed, right? We didn't see this reaction when Tamir Rice was killed. I mean, I can name so many names, right? And so while I appreciate an increased level of awareness, to your point, I want it to translate into something, right? And so, you know, we all have different types of privilege. And so let's leverage the privilege that we have to advance what we want to advance if we really want to do it, right? And so what that means is we can leverage our financial resources, we can leverage our social capital. What it means is we can allow ourselves to be uncomfortable and get proximate to the issue, which many people don't want to do, right? Many people are afraid that they're going to say the wrong thing, that they're afraid that they're going to offend someone, and therefore they just opt out, right? Well, opting out isn't going to solve anything. And in order for things to change, the dominant culture needs to be a part of that change, right? Folks of color, lower income folks who have vulnerable identities have been fighting this fight from day one, right? And we are making small progression, right? But unless someone is willing to challenge the status quo, then significant change isn't going to happen. Yeah. And so, you know, I would say leverage whatever privilege you have for this issue, like for racial justice, right? And so there are many, many ways that you can do that. I wholeheartedly think that the process starts from within, right? And so you have to understand who you are and what your identities are and how you show up in the world and what that all means. And a lot of people don't want to do that work. The work of racial justice is not always fun. It's not always pretty. And when it starts to become difficult or when it starts to make people uncomfortable, they don't want to do it anymore, right? I have conversations with people at organizations who, you know, don't understand why the community views them the way that they view them, and then are like, well, we just need to educate them on what we do, right? No, they know what you do. You need to understand why they feel the way that they feel, right? And so we need to really shift the way that we are thinking, the way that we are approaching this. We need to value the lived experience of people, right? We can live in a world where there are multiple truths in some instances, right? And so because that experience is not your experience, it doesn't mean that it's not valid, right? So these are all like really small things that folks can do to kind of move that needle forward. I would encourage people to get involved in community organizations in communities that don't look like where they live.
Yep.
Right? Be involved, volunteer, give your money, give your time, right? I think there's a saying about you can give your time, talent, or treasure, right? These are all different ways in which folks can get involved. And so, but I think people, and to be like very blunt, right? I think white people have to be willing to be uncomfortable. And we live in a world where white people can live their lives and not be uncomfortable, right? They cannot be challenged. And that's very comfortable. And I understand that. But in order to affect change, you have to be willing to kind of allow yourself to be in that vulnerable space to grow.
Yeah. And I think that like organizations need to just start talking about race. And I think that they're very uncomfortable bringing up race. Like I'm working on a class project in Dr. Gaynor's class where I had to ask my HR person for some demographic info. And I was asking a couple of people and all of them were like, oh, this might be a little iffy. And I'm like, no, it's not. And it shouldn't be. It should be something that is not controversial at all.
Right. Yeah. And we all have racial identities. Some of us just are forced to think about it and experience it far more than other people. Right. And so that creates that discomfort with race conversations. Black people are not uncomfortable talking about race. Race is very much a part of our everyday existence. Right. Mm-hmm. But without having those conversations, we're not going to be able to move things forward. And so, when I do trainings, it's like no one is expecting anyone to always have the right thing to say, always say the right thing. I don't always say the right thing. And if I mess up, I apologize and I don't do it again, right? And it's all good, right? So there's a way, and so fear of not saying the right thing, or fear of being seen as racist should not prevent people from engaging in these conversations and doing this work. But it probably is one of the biggest barriers, because people are like, oh, I don't want to do anything because they're going to think I'm racist, or I don't want to say the wrong thing, or this, I don't know, right? So I'm not going to say anything. And that just isn't going to advance the national conversation.
Right. Well, and Jackie and Dr. Gaynor, I wanted to share with you 2 examples of things that I had this week that I thought would be interesting for discussion. One was, it actually came up yesterday. We got feedback from, through, not even directly to me, through another resource about the utilization of the X in women. So being able to talk about embracing intersectionality. We are not perfect with Wise Wellness Guild, have never claimed to be, but we are really trying to step more into this space. And it was perceived, we received the feedback that the use of the X might be off-putting for allies. This is the way that they said it, off-putting for allies because it communicated anti-man. And I said, that's not at all what it's about. You saw it and you made a judgment and you decided that you were offended, or that you were being targeted, that this was it was anti. And I said, the actual philosophy around it is actually inclusivity and welcoming more people to the table and expanding the term woman to be inclusive to transgender, non-binary, LGBT community. And so I think it's really interesting that, again, like even the use of that, of, the assumptions that are made, that's just, again, in the last 24 hours, one of the examples of like, we are really trying to make change. And where I'm stepping into this is again, and like acknowledging my own fragility, right? At first I was like, oh, should I not use that? And I was like, no, Stevie, you know who you are. Like, this is the work. This is it. And people are going to come for you. And people are going to say, maybe we shouldn't use it, or maybe, and like, that's not what I stand for. I'm congruent with my values. And being able to then step even further into it and saying, how do we make sure that I'm advocating on behalf of the communities, so the people, and because this is a top leader in an organization in Cincinnati that shared this feedback, that gosh, what an opportunity for me to take a step further. And I'm not looking for accolades or affirmation or anything. I'm more just like want to illuminate the fact that I think that being I felt my own fragility of being attacked in that stance. And I think that being able to, I'm not a person that likes conflict, and I do not like being told that I'm wrong. And I think that understanding that that is a part of this work, and that it doesn't have to be conflict, or being told you're wrong doesn't have to be a big dramatic thing, right? It doesn't have to be ridden with all of this guilt and shame. If you're committed to doing the work, that's a part of it. It's a part of acknowledging your own shame and guilt and then getting through that. And so I would just love to pause there for a second, because in the spirit of learning, I wanted to just hear more from your perspective on, as we are having these conversations, and knowing if there's any examples that you might have of people who, how you have approached them about maybe things that they have not been doing, not like a way that you wanted to give them feedback, or a way that they've stepped into something that might be helpful for this community.
Yeah, so first I will say, I would push back on the idea that allies would see the use of women with an X anti-man, because if that person was a true ally, they would understand, right? And so I would kind of push back. I'm like, well, if this offends you, then you're really not an ally of the LGBTQ community, right? Particularly non-binary, gender non-conforming folks. I also want to kind of elevate how your story really shows how quickly even something small that challenges the status quo can result in uncomfortability, right? And so a small challenge to binary definitions of gender, right? Let's see gender as more than just two groups. Let's see the category of women as a wide range of people who identify as women, whether or not they're born female or not, right? Mm-hmm. And that small push led to, that small challenge to the status quo led to someone like that comment getting to someone who leads a major organization and replaying that, right? And so, it's not lost on me that comment even got to that space, right? And so there's a whole lot there. I think it also illustrates the importance of the narratives and the words that we say, and how words in our narratives are really, really important, and how powerful they are. And we often take our words for granted and assume that there's no meaning behind them, but there's a lot of meaning behind the words that we use. So more directly to your question, in terms of, so an example of when I've challenged someone, is that?
I think it's more the end goal and objective of this question is, I would like for people who are nervous about stepping into the conversation and being wrong, I would like to encourage people that there are ways to coach back on the giving the feedback, and inspire people who want to share the feedback. And then also the people receiving the feedback, understanding that that's a part, being uncomfortable is the work. Actually, it's part of the unlearning. And that's the power of this platform, is I'm trying to help people understand that that's the point. Like, it's not supposed to be cozy. Like,
yeah,
it's supposed to be your whole life. So
yeah.
It's trying to get uncomfortable. Yeah.
And so one of the things that I highlight at the beginning of my courses and at some trainings that I do, I have this image that talks about learning edges and comfort zones, right? And so if you imagine a circle, right in the middle of that circle is our comfort zone. It's nice and cozy. Things are exactly how we want it. No one's challenging us, right? But as we get access to more information, we start to move out of that comfort zone, because some of that information we get access to challenges things that we were taught over the course of our life, right? But that is really uncomfortable. And depending on what that information is, it can totally shake our foundation, right? And that's scary. That is scary to think that the way that I thought the world operates is not the way that the world operates, right? Because that's a fundamental shift in perspective, right? And then what comes next is, well, now that I know this, what do I do with it, right? But I wholeheartedly agree with you. The good things happen in those uncomfortable spaces, and the learning happens in those uncomfortable spaces. Learning doesn't occur in those spaces that are nice and cozy because there's nothing challenging in there. And Stevie, to your point, engaging in racial justice work, particularly as an ally, is very uncomfortable and it's very challenging. But it is nothing compared to dealing with racism in your everyday life or dealing with any ism, right? And so I would push back and say, you know, if you think that it's uncomfortable to be in this space, imagine living your life where you have to deal with racism or transphobia or sexism or whatever, right? On a regular basis. Right. And so when you think about it in that context, I'm of the mindset that that's the least you can do is be uncomfortable when I have to plan where I go on vacation based on where I feel like my wife and I will be safe.
Wow.
Right. And everyone doesn't have those considerations. And so, you know, I think adding some perspective to that conversation can help. Right. I also, but I'm not of the mindset of trying to force people to a place, right? I'm not trying to force someone who is not interested in having these conversations or who is interested in engaging in this work to engage in this work. You know, like for students, I can give you access to information. What you do with that information is what you do with it, right? And so I also recognize that we all have to care for ourselves too, and where we are in our work and in our social justice work. And sometimes it's not worth it to engage with people who just absolutely are not open. And that's okay. Like my attitude is hopefully there are enough open people that I can engage with that will begin to move the needle forward. And then those folks who are so close to it become outliers.
I think that that's just so powerful. And it's a fantastic, just continual reminder for people who are doing the work that, again, as we think about our role in being allies and stepping into this space, understanding when the right time is to push and when the right time is to create the opportunity and platform as well. And I find myself in that. I've flubbed many a time of trying to be in that space. And I think that it's just like the continual feedback loop, I think is just part of why we're even here, right? Like doing this.
Yeah, and we all mess up, right? We all say the wrong things, and that's perfectly fine. We don't always get everything the first time around. That's okay too, right? But to allow that to stop the work, you know, that's what we don't want.
I will say that there's been some places where I am encouraged by some of the work that's happening. I know that in my partnership with the Christ Hospital, they specifically are working on the challenge with morbidity in Black women who have maternal morbidity and giving birth, and like within 7 days, and the connection to hypertension and what that looks like. And I think that it's, again, I have a friend who told me in the Matrix, there's like the 2 pills you take, and you take the red pill and you can see everything. And it's interesting when you do kind of have your eyes open, the more you're starting to see that where the real challenges are. And I think that that's one area that I'm encouraged by. that they're really doubling down and investing in that space, and then also in the mental health of in postpartum mental health, and being able to really kind of step into that space, in particular for all women, but particularly for women of color. And I guess that my push there is like, well, not perfect, and just calling out that one specific system. I do think that as we look at COVID-19, this isn't when, 2020, you just said in the beginning, isn't when like racism started happening, right? And this isn't when there were healthcare disparities in 2020. And COVID-19 is just a microcosm of the greater issue. I am encouraged in some spaces where there might be some more progress that I would love to offline share with you and get your feedback on just how we're stepping into it to make sure that it's as impactful and effective as we can make it.
Yeah, absolutely. And I really hope that in addition to, the things that you'd identified that Christ Hospital is looking at, that they're also looking internally at the ways in which their policies and practices could exacerbate a racial disparity, particularly around maternal morbidity, right? And I mean, there's the case of Serena Williams. There was recently a medical doctor who, the doctors weren't listening to her. And there's research that shows that medical professionals treat Black patients very different, right? There was, I think at the end of last year, a report that came out that talked about the difference between a Black doctor treating a Black patient and a white doctor treating a Black patient, right? And how that leads to significantly different outcomes for the patients, right? And so I hope all of that is a part of, what the hospital is looking at, but would love to chat about some of the other stuff that's happening too.
I think that would be amazing. And yes, getting that, making sure that that's there. Like I said, it's just really incredible work. And I think that you did, even mentioning going back, what I love about conversations with you are that we talk about, we've got the issue, but then we've got all the things leading up to it. And as you talked about Black doctors, being paired with Black patients, white doctors and Black patients. I mean, I know the incidence of female physicians as a whole, but then you take it to female physicians who are Black, and like the pool of, I can tell you, I know a handful of Black physicians that are female, and how they must be so stretched to be advocates and to show up. And we know that the burnout of female physicians is among the highest in the country, and compounded with all of the other pieces that, you're really combating. I don't know, it's just something to really, I'm encouraged to go do some more digging on my end about that specific, what's being done to recruit more Black men and women into medicine. And I would just love to do some research on that for myself, just speaking out loud. If you have any.
Well, there's a whole history in the US about the intentional closing of medical schools that trained Black people. So you may want to start there.
Wow, that's amazing. This is again, this is the part that I'm so grateful for your expertise. And Jackie, I'm always so grateful for, we really look to you to be able to provide, kind of what's happening and how we can step into these conversations. So I'm just forever grateful with you, Dr. Gaynor, your expertise and knowledge, and having you as a resource here in the region is something that is just incredibly powerful for us. I know it's been a pleasure following you on social media and having you here as a part of the WISE community. So I'm really looking forward to future conversations and topics that we can touch on.
Awesome, thank you. And listen, these are conversations that we have in the MPA program at UC all the time in all of our classes. And so, little plug if anyone's interested in getting their graduate degree.
So I have a question in regards to that, seriously. So as we look at, from a graduate degree standpoint, can we just spend the last 3 minutes talking a little bit about certifications versus full-blown MBA, and like how people can maybe step into this, because we within the WISE community have had a lot of discussions on maybe certain points of focus versus broader, like full Masters of Public Health, or kind of really getting into the full master's program.
Yeah, so I mean, so our department doesn't offer any certifications. We offer an MPA, which is a Master's of Public Administration. If you were interested in going into business, which is an MBA, you would go to the Lindner Business School. And so an MPA allows someone who is interested in working for a nonprofit organization or a public government organization at any level, so it could be local, state, or federal level. And we train and we have conversations around what's happening in the world and how to manage in those spaces, how to be a leader in those spaces, right? And so it's a social justice program, and so social justice is recurring across the curriculum. It's the only social justice master's in public administration program in the country. So really honored to be a part of that. So if people are interested in doing like an MPH, which is a master's in public health, that obviously focuses in the healthcare field, side. MPA is more general, right? So it doesn't have a specific disciplinary focus. It's more general and just trains trains managers and leaders in the public and nonprofit sector.
That's fantastic. And I put the link to the
Thank you.
Masters in Public Administration page that you can go and check out of. And I think that this, for me, this is where when we talk about people who are really interested in exploring like the lifelong journey of what this is going to take, I think that one piece that, again, I am encouraged about are there are people that have recognized that this is what they want to make their lives work. And I am just really grateful for you kind of paving the way and showing what the possibilities are with that, and you investing in our region is just something that I continue to just be really inspired by. So thank you.
Well, thank you very much. I appreciate it. And thanks for welcoming me here to this space.
Oh my gosh. Well, of course. And we're going to wrap up today, but thank you so much again for joining us. And for the WISE community, we have a series of different events that we'll continue to have, highlighting and heroing the different disparities that we have with heart disease, as well as other spaces. We have International Women's Day event coming up on March 5th, Challenge for Change, which we will be discussing financial literacy and financial wellness in a variety of different capacities and communities that we're really starting to see the implications for women stepping into this COVID-19 crisis. And so if you want to learn more, you can go to wisewellnessguild.com events to check us out. So thank you everyone for joining us today. Really appreciate the time. Have a great rest of your afternoon.
Thank you. Bye.
Bye.